Metastatic breast cancer is defined as stage 4 breast cancer. When this happens, cancer has spread to other parts of the body. We sit down with medical oncologist Dr. Michael Moffett with M2 Oncology to learn how breast cancer can metastasize and what new targeted therapies are available to help patients with metastatic breast cancer.
Our only option to treat breast cancer that had traveled was typically using something like chemotherapy. And chemotherapy is very toxic. And while it would control the disease, the cost in terms of side effects for quality of life was quite high. So while you would potentially be successful in controlling it for a period of time, you actually really started to hurt that patient or damage that patient just from the toxicities of the drugs.
Dr. Moffett says treating breast cancer is about treating the entire individual, allowing a patient to live a normal life while controlling their disease.
I think that people have a perception that if they're diagnosed with a cancer that's come back, they're going to die from that cancer. It's going to consume their life. And what we know in metastatic breast cancer is very, very often we can control this for years, if not decades, and allow somebody to have a normal life. And really, I would focus on the hope that this is a disease, while we may not be able to quote unquote cure it, we can allow you to continue to have the life that you really want to have.
State-of-the-art technology and education now allows doctors to help patients diagnosed with metastatic breast cancer to not only survive, but thrive.
Nowadays, we've really entered kind of a new era in trying to be able to manage this. We manage it either by blocking hormones, by adding a medicine that will target a switch that can actually turn the breast cancer off. We have drugs that will go and stick to the breast cancer cells themselves and turn them off. We have other drugs that actually bring chemotherapy directly to those breast cancer cells. The result is that the therapies are much, much more effective and they're much less toxic.
It seems everyone has a breast cancer story. Some have battled it firsthand, and others have helped loved ones face the challenge. Now is your chance to help in a whole new way by buying a special pink patch from your local law enforcement agency. Each patch is a $10 donation, and your contribution stays local, supporting the Marjorie E. Radin Breast Care Center at Clovis Community Medical Center. Donate or learn more at valleypinkpatch.org.